Hi, Nicole.
Hi.
I'm Dr. Matt. How are you?
I'm good. How are you?
I'm okay. So you're here with some back problems.
Yeah.
All right. Can you tell me exactly where it is?
Yeah, specifically middle back to lower back.
Okay.
I wake up every morning and it's just very sore and achy, and it's been going on for about 2 months now.
Right. Have you had any accidents or injuries?
No.
Okay. Do you work out a lot?
Yeah, I go running about 2-3 times a week.
Okay. And how often do you change your shoes? Just
I would say monthly.
okay. So definitely that's not one of the problems. How would you describe the pain? Is it sharp or dull?
It's somewhere in the middle, but definitely in the morning more sharp when I wake up.
Okay. And is it constant throughout the day?
In the evening, it's actually fine, but in the morning, it really bothers me.
Okay. And do you sleep on the side or on your back or on your belly?
I usually sleep on my side.
On the side.
Mm-hmm.
Okay. That could definitely bring a flare up of that pain. Let's go ahead and take a look and see exactly what's going on. Have you had any accidents?
No.
Not that you know of.
Nothing that I know of, yeah.
Okay. And you haven't changed your workout routine?
No.
Okay. You're taking any vitamins?
Yeah, I do take my daily multivitamin.
Okay. And are you following a certain diet?
No restrictions right now, no.
Okay. Do you have any medical conditions?
No conditions.
All right. Have you ever been told that you have scoliosis or any abnormal curvatures of the spine?
No.
All right. Okay. I'm going to have you stand up and I'll take a look at your hip alignment and your shoulders. So we're going to check the spine to see how mobile it is. In a chiropractic environment, this is what we do. We make sure that we increase the mobility of the spine, and that usually helps for more nutrient flow to go in those spaces, and the spine just gets healthier by itself.
Okay.
Also, we are adjusting the alignment, so that really helps to bring it in a not very straight, because we don't want it too straight, but in that shape that we need to function properly.
Sounds good.
Okay, so go ahead and stand up for me. Okay, Nicole, so go ahead and take a few steps for me. Just walk normal pace. Don't even think about it. Keep on walking. We're looking for how you'll place your sole on the ground. Keep on walking for me. All right. Good. Okay. Definitely some pronation there. All right, go ahead and turn around. Okay, go ahead and stop. Good. So we're going to take a look at hip alignment. Let me know if you feel any kind of pain as I'm palpating. We're looking at sacral and
Yeah, I have
lumbar.
pain right there, in that area.
Okay. This is a very common area where we get a lot of inflammation, especially runners, so we can do an adjustment. I'm going to have you place the left heel into the ground and try to put some weight on it, okay?
Okay.
Go ahead. Place the left heel. No, go ahead and look at me right here. So in front of you.
Oh.
Yes, perfect. Okay. Bring it back to center. Do the same thing on the right side. Good. Bring it back to center. Okay, now I'm going to have you lift up your left knee up in a 90-degree angle. Okay? All right, come back to center. And same thing on the right side. Okay. Slight dislocation there. Okay, I'm going to check this as you're laying down on the table. And moving up. Okay, this is what I'm gonna have you do. I'm gonna have you lean a little bit forward and try to tuck your chin in. Okay, so we're looking at any abnormal curvatures. Okay. Slight deviation to the right. So you do have a mild scoliosis. Go ahead and come back to center. Okay, I'm gonna have you place your arm just like this into 90-degree angle with your body. Alright, so it's right here. Okay, does it hurt when I press down?
A little bit.
Okay, go ahead and come back to center. Okay, now we'll do the same thing with the right arm. Okay, so this is what we have to loosen up a little bit. I can definitely feel a knot here. Any pain as I'm pressing down?
No.
Okay, go ahead and get back to center. And now I'm just gonna ask you to kind of try to touch with the back of your palm right here in between your shoulder blades. Okay, that's pretty good flexibility right there. Just going to press under. Let me know if you feel any kind of pain. Pretty good mobility on the right side. And now we're going to repeat on the left. Okay. I'm going to have you lay down first face up. All right, go ahead and relax. So we are going to try to adjust your neck and your cervical spine. We're going to increase spine mobility. Just simply palpating the occipital vestibuli right here. Moving down in the posterior pockets. Go ahead and relax your head in my hands. I'm just going to try to elongate your neck, applying gentle pressure. Okay, I'm ask you to take a deep breath in and breathe out. Okay. I'm going to apply some oil. It's going to help to massage this area. Go ahead and turn your head towards the left. Okay. Before we do an adjustment, I want to make sure that the muscles are warmed up. This is going to feel a little bit cold, so we're applying some gentle cold therapy as well to stimulate blood flow in this area. Okay, and we'll do the same thing but on the other side. So this is going to feel a little bit cold. Just using a circular motion to go as deep as possible into the muscle. Okay, go ahead and take a deep breath in and breathe out. Good. And we're going to work on fingers as well. Okay. All right, take a deep breath in and breathe out. Very good. Is it okay if we take off the socks?
Yeah.
Right. Okay. I'm going to do a hip adjustment as well. Take a deep breath in and breathe out. Okay. And one more time. Take a deep breath in and breathe out. Okay, we're going to work on your toes as well. Not all the toes will crack, that's for sure. We're just trying to stimulate blood flow in all the joints. Okay, perfect. Okay, for this, I'm gonna ask you to give yourself a hug, just like that. So put your arms on your shoulders, perfect. And we're going to lift this knee up. And on the count of 3, you're going to take a deep breath in and exhale. Take a deep breath in. 1, 2, 3. Okay, very good. And now we'll do the same thing on the other side. Take a deep breath in and breathe out. very good. Okay, go ahead and flip over. So I'm going to have you face down and I'm going to adjust your spine now. Okay, I'm just going to lower the pants a little bit and we're going to take a look at the lower spine. So what I'm going to do is kind of like skin pulling therapy. I know we've done that before, and we're going to kind of increase the blood flow to the lower side of your spine. All right, this should not hurt. Okay. 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 Okay, all right, go ahead and take a deep breath in and breathe out. Okay, very good. Go ahead and take a deep breath in and breathe out. Good. And one more time. Breathe in and breathe out. Okay, very good. Relax. I'm going to stimulate the lymphatic drainage, working on all major points, starting with the neck area. Okay, so we're going to work on detoxifying these muscles. So we're starting on the lower side and moving up. Runners usually carry a lot of weight around their spine, and having a good posture when you run really helps to maintain those muscles healthy and in a good position. Just going to lower a little bit this side, and I'm going to work on one side at a time. Okay, I want to take a look at your alignment now. Okay, so we're gonna cut that part. And this will be the final part. Okay. Go ahead and lift your left leg up for me, please. Good. Back to center. And again, same leg, left leg up. Good. Back to center. Okay. Good. And now do the same thing with the right leg. Good. Back to center. And do it one more time. Perfect. Okay. Very good. All right, I'm gonna have you sit up. All right. So I think I was able to really adjust your middle back. That's what I focused on. And go ahead and tell me, how does it feel? Are you still feeling the same sharp pain?
It feels better now, yeah.
Okay.
Thank you so much.
You're welcome. I'm just going to go ahead and print some forms for you. You're going to find there are some exercises that you can do in your own time. Just try to repeat them 3 times a day, one time in the morning, one time in the afternoon. They're mainly to buildify the core muscles. That's what is going to keep your spine a little bit more aligned, and also it's going to increase the flexibility.
Okay, thank you so much.
You're welcome.
Appreciate
It
it.
was very nice to meet you. I'll see you soon.
That's great.
Hi, Katie.
Hi.
I'm going to do a full body massage.
Okay.
All right. We're going to use cupping and a little bit of heat to really put the circulation in motion, and that's going to help with the blood flow and ease some of the pain that you're having. Okay.
Sounds great.
We're going to start with you relaxing. Just going to use my hands here just to feel for any movements. Going to apply anti-inflammatory oil, starting with shoulders, Okay, gonna have you flip over.
Okay.
You have lots of knots here, very close to the shoulder blades. We can definitely try to loosen them up. I think I'm feeling something like a muscle spasm. It's very rare, which means that you're very tense, especially on the right side. Doing some soft tissue work up here. It's going to help to decrease inflammation. Feeling a lot of tightness along the paraspinal muscles. This helps to apply multiple pressure on targeted muscles. It helps to reduce inflammation and decrease pain levels. This applies gentle cupping therapy. It helps to remove toxins from the muscles and increase circulation in those areas. trying to increase your scapular mobility by breaking down some of the soft tissue that has been accumulated around it. This helps to stimulate blood flow. Okay. We're going to work on the calf muscles as well, especially with walking and any other type of exercise, jogging. These muscles can get very tense working on multiple pressure points that are located on the heels. Going to work on the lymphatic drainage. This helps to balance hormones and decrease inflammation by removing some of that lymph that has been accumulated. Cupping therapy helps with blood stimulation and to remove toxins as well. I'm using warm medicine balls to really stimulate blood flow. Okay, Annie, so I'm going to go ahead and put gloves on, and then I'll take a look at your scalp. Is there anything in particular that you would like me to address today?
No, not really.
Okay. What I'm going to do is I'll first do a neck and face measurement and palpation just to make sure that there is nothing anatomically going on around here. And then we'll move to the scalp area to check for any skin lesions or anything abnormal. So I'm just slowly palpating your jaw. I'm looking for a lymph node enlargement. Okay, go ahead and slowly open your mouth as wide as you can. We're checking TMJ to see if there's any popping or clicking. Go ahead and close it. So I did feel popping on the right side. Let's go ahead and do that one more time, but just a little bit slower this time. So slowly open, or as wide as you can, and slowly close. Okay. Checking lymph nodes under the chin. And above the clavicles. I'm not feeling anything swollen. And in front of your ears, here we have the preauricular lymph nodes. Going to check your sinuses above the eyebrows. Any pain as I'm pressing down here?
No.
And under your eyes, I'll slowly palpate. I'm not feeling any lesions. Okay. So we're going to go ahead and start checking your scalp now. Okay, so we're going to start first with the left side. I'm going to have you turn your head towards the right. scalp looks healthy. I'm not seeing any abnormal cell growth. I'm going to check for any neurological lesions. So what I'll do is I will touch you with two textures. One is going to feel sharp, the other one is going to feel dull. Can you go ahead and tell me if this feels sharp or dull?
Sharp.
Okay. What about no?
Dull.
Okay.
Sharp. Dull. Sharp. 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 Sharp.
Can you go ahead and tell me if this feels sharp all the way?
Yes.
Okay. And how many times do you feel this dull sensation touching you?
2.
And now?
1.
And now?
2.
Okay. We're going to do a pressure point test. So what I'm going to do is I'll touch you with either 2 pressure points, like this, or just 1, like this. So go ahead and tell me if you feel 2 or 1.
2. 1. 2. 1. 1. 1. 1.
And go ahead and tell me if this feels cold or warm.
Cold. Warm. Cold. Cold.
Okay, go ahead and tell me when you don't feel the vibration anymore. Just say now.
No. No. No.
There was a slight delay on the last one. So what I'm going to do is I think we're going to take a sample from the scalp area. And there are 2 points that I would like to test. First, we're just going to go ahead and prepare the site. We need to bring down the acidity so that we can collect as many cells as possible. So first I'm going to apply a basic gel. On the 3 main points that I think we should definitely sample. And we're going to go ahead and make sure that it goes evenly on the side of each hair follicle. This is a paper strip to make sure that we have the right acidity. We're going to go ahead and collect a sample. We're going to remove the excess solution that is left. I just see a little bit of flaky skin around the hair follicles. Instead of scraping that off, we're going to try to apply a solution that helps with lowering the base of the scalp. But first I want to make sure that there is nothing wrong neurologically. Sometimes nerve impulses can cause this kind of condition. So by ruling that out, we can go ahead and start a treatment. Can you go ahead and tell me if this feels cold or warm?
Cold. Warm. Warm. Cold. Warm. Cold.
And does this feel sharp or dull?
Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Does this feel sharp all the way?
Yes.
And do you feel this 2 or 1?
1. 2. 1. 1.
Go ahead and tell me when you don't feel this vibration anymore. Just say no.
No. No. No.
And does this feel sharp or dull?
Sharp. Dull. Dull.
Does this feel cold or warm?
Cold. Cold.
2 or 1?
1. 1. 2.
Sharp or dull?
Dull. Dull. Dull.
Okay, go ahead and tell me if you feel this warm or cold.
Warm. 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 Cold. Cold. Cold.
And how many taps do you feel? 1, 2, or 3?
1. 2. 2. 3.
And do you feel this 2 or 1 pressure point?
1. 2. 2.
And does this feel sharp all the way?
Yes.
What about now?
Yes.
And now?
No.
Okay, where doesn't it feel sharp?
And the end.
Does this feel sharp or dull?
Dull. Dull.
And is this cold or warm?
Warm. Warm.
Okay, a little bit of hyposensitivity there. We're going to repeat the process. So we're going to just apply some of these pearl solutions to the area. We're going to allow the serum to lower the acidity. And we're going to test now. Make sure that it doesn't change in color. Looks good. And now we're going to go ahead and collect the sample. Okay, I'm going to go ahead and do a massage that helps to stimulate stem cell production. I'm going to apply some cold therapy first. And we're going to use an acupressure technique to stimulate blood flow. This scraping technique usually helps to remove any harmful toxins. And this applies multiple pressure points around the whole scalp area. We're focusing on the occipital and the mastoid bones that are very close to the earlobes. And now we're going to do hair pulling. This usually helps to stimulate blood flow in targeted areas. What it does, it moves the scalp cells that are right under the hair follicle. It helps to bring down inflammation. Okay. Hi, Ivy.
Hi.
My name is Dr. Matt. I'm going to do your examination today.
Okay.
So, can you please verify your last name?
Yes. A-S-M-R.
Perfect. And your date of birth?
It's June 22nd, 1992.
Okay. And you're here for some back pain?
Yeah, it's mostly in the neck though. I have it's pretty sharp pain in the back of the neck.
Is it in the middle, right, or left side?
Middle, and I feel like it radiates more to the right.
How long has that been going on?
It started maybe a couple of months ago.
Months ago? Okay. Any new stress going on in your life right now?
No.
Okay. Any surgeries to the back or neck?
Mm-mm.
Okay. Any incidents that you know might have caused this?
No, not.
So it just came out of the blue. Are you taking any medications?
No.
Okay. Do you have any allergies?
No.
Have you ever been hospitalized?
No.
Okay. Any new onset of headaches? Okay.
No. I do get migraines every now and then, but nothing out of the ordinary.
Okay. And for the migraines, where is the pain usually located?
I feel like mostly on the sides of the head.
Are Are you experiencing any tingling or any numbness in the tip of your toes or fingers?
I haven't noticed that, no.
Okay. If you look down or all the way up, do you feel any shooting pain down the spine?
It doesn't shoot down, it just hurts like it's still there.
Okay, so localized. Alright. Okay. We're going to start by examining all 12 cranial nerves, and then we're going to try to see if we can do anything to manage the pain in the office today.
Okay.
I'll sanitize my hands here. Have you noticed any fevers, flu-like symptoms, body aches, any shortness of breath?
No.
Okay. So I'll put this sublingual under your tongue. I'm going to ask you to hold it with the left hand for me, please. Let's go ahead and measure your oxygenation and your heart rate. Go ahead and relax. And I'll put this on your upper arm and take your blood pressure. Okay, go ahead and check that. 97.3 Fahrenheit. That's good. Did you have anything to drink before coming in?
No.
Okay. Okay, so it's going to feel a little bit cold. Okay, blood pressure is a little bit elevated. 135/60. Oxygenation 97%. Let's go ahead and write this down. 86 heart rate. 135/60 blood pressure. The temperature was 97.6 Fahrenheit. Okay, we'll keep an eye on the blood pressure. Sometimes what can happen is when you know that you're at the doctor's office, you automatically get a little bit more anxious and worked up. So we're going to keep an eye on it and recheck it.
Okay.
Let's go ahead and put on some gloves. And I'll begin exam. Okay. Is it okay if I listen to your heart and lungs?
Yeah.
All right. Okay. I can hear only S1 and S2. No S3, no S4. Going to check for any murmurs. Can you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. Take a deep breath in for me and exhale. And one more time, take a deep breath in and exhale. Okay, very good. Are you experiencing any ear pain?
No.
Okay. I'm going to check your reflexes. So go ahead and relax your jaw for me. A little bit more. Okay. Relax. Okay. I'm just going to raise this arm. Fully relax your arm. Okay. Go ahead and relax. Okay. Let's go ahead and check your legs as well. Okay, a little bit diminished on the right side. Okay. Alright. Go ahead and give me a big see, okay. And I'm gonna put the spatula inside this your mouth on the right and the left side. I'm gonna ask you to push it with your tongue, okay? Good. Okay. Go ahead and look straight at my nose. Okay. Can you cover one eye for me, please? Can you tell me how many fingers you see?
1,
Okay.
2, 1, 1, 3,
Okay. Go ahead and switch eyes.
1, 2, 1, 3, 1.
Okay. Go ahead and relax. I'm gonna ask you to put these glasses on and then cover one eye at a time, okay? Perfect. Cover your right eye. What color do you see?
Blue.
Okay. And your left, what color do you see?
Red.
Okay. Very good. You can go ahead and remove the glasses. All right. I'm going to go ahead and check your hearing now. I'm going to ask you to close your eyes and tell me when you don't hear this sound anymore.
Okay. No.
Good.
No.
Now go ahead and tell me which position here is louder, position 1 or 2.
Okay.
And this is 1
Mm-hmm.
and 2.
Pretty much the same.
This is 1 and 2.
2.
Okay. We're just going to go ahead and do the right ear one more time. So this is 1 and 2.
2.
Okay. Now we're going to check vibrations on the upper side of your body and then we're going to move down. Can you please tell me when you don't feel the vibration anymore? Go ahead and close your eyes.
No. 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 No.
Okay. It's been a very long time since we tested your olfactory nerve, so let's go ahead and check that again and see if there is anything concerning. Can you go ahead and close one ear for me? I'm going to ask you to identify what this smells like, okay?
Okay. Not really sure. It smells like some spice, maybe like garlic, onion, I don't know.
Okay.
Smells like some kind of essential oil.
Okay, now go ahead and breathe with both ears open.
Like smoke.
Okay. Let's go ahead and check your taste as well. So this is just a test paper. I'm gonna ask you to kind of taste it, put it in between your lips.
It's pretty bitter.
Bitter. Okay.
It doesn't taste like anything.
Okay.
It's really bitter too.
Okay. Was one more bitter than the other?
I think this one.
Okay.
Like salty.
Okay. There are definitely some inconsistencies there. The taste test was normal, but we did have some difficulty with the olfactory nerve. So all of that might be connected to some nerves that are shooting in the back. So I'm gonna go ahead and check your neck as well to make sure that we're not missing anything. Okay, we're gonna go ahead and do some sensory tests here on the front side, and then we're going to move to the back.
Okay.
All right. That's good. Okay. I'm gonna ask you to close your eyes and tell me if you feel cold or warm.
Cold. Warm. Warm. Cold. 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 Warm. Warm.
Okay. Now I'm going to introduce two more objects. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. And this is what dull is going to be like. So go ahead and tell me if you feel cold, warm, sharp, or dull.
Okay. Sharp. Cold. Dull. Sharp. Warm. Sharp, maybe. Dull. sharp, sharp, warm, warm, cold, cold, warm or dull, same, dull or warm, sharp, 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 cold, dull maybe, dull, dull.
Okay, go ahead and tell me if you feel this equally on both sides.
Yeah. Yeah. Yes. Yes. Yes.
Okay, can you please go ahead and squeeze my fingers? Okay, go ahead and put your arms in front of you. Good. And flip them over. Okay, so we're just looking for some shakiness. Try to keep them straight as possible. Okay, that's very good. No shaking at all. Okay, I'm gonna have you lay down on your tummy and I'll take a look at your upper back and neck area.
Okay.
Right, is it okay if I remove the necklace? Just don't want it to get tangled. Okay. Oh. Okay. Just going to go ahead and palpate here on the right side. Looking at the skin as well to see how well it is perfused. I'm not feeling anything swollen, no lumps. Go ahead and lift your right leg up and put it back down. And we'll do the same thing with the left and put it back down. Okay. Going to take a few measurements. It's going to feel a little bit sharp. looking for any information which would definitely be indicated by an asymmetry. We're checking length of the spine as well. Go ahead and tell me if you feel this on the left or right.
Right. Left. Left. Right.
I'm noticing a kind of a darker mark here in the middle. Is it painful when I touch it?
No. Left. 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 Right. 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 Left. Right. Left. Left.
Okay, go ahead and tell me if you feel this wet or dry.
Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Wet. Dry. 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 Wet. Wet.
I'm going to touch you with two textures. One is going to be dull. This is what dull is going to feel like. And the other one is going to be sharp. So go ahead and tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Sharp.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No.
Okay.
No. No. No.
Okay. Alright, I'm gonna have you stand up and we're going to discuss the results.
Okay.
Okay, I mean, it definitely looks concerning, so we're gonna send you for radiology. We're gonna do some x-rays and maybe a CT scan as well. Are you allergic to contrast?
No.
Okay, so we might have to order some contrast too, just to take a look at what's in front of the neck and the soft tissue. It it has to be investigated a little bit in detail. And if I see anything concerning, I'll go ahead and give you a call back.
Okay.
All right.
Thank you.
You're welcome. Thanks for coming. Hi, Katie.
Hi.
My name is Dr. Matt. I'm going to do your dental exam today.
Okay.
Can you please verify your first and last name?
Sure. It's Katie ASMR.
And then date of birth?
March 23rd, 1989.
Perfect. Do you have any allergies to medications?
Not that I'm aware of. No.
Okay, so I'm going to ask you a few questions to make sure that I have all your history, and then I'm going to lay down and do the dental checkup.
Okay.
When was your last dental exam?
It was about 4 months ago.
Okay, do you have any root canals?
Yes. Yes, I have one on my back left. Yeah.
Do you have any dental implants?
Mm-mm. No.
Are you experiencing any pain or discomfort?
TMJ. Yeah, this side of my jaw is just very misaligned. I have like some kind of knot here that's developed because of it, I believe. It's just something's very off. There's clicking, popping. Sometimes it's hard to open my mouth, and just general pain when I'm chewing food.
Okay. So I did see that you brought in some scans, and I did take a look at them. It does show the cyst. It doesn't look like it's suspicious or anything. It looks normal.
Okay.
I'm going to go ahead and do my exam as well and see what we can recommend for you. On a scale of 0 to 10, how would you rate your pain?
TMJ pain?
Mm-hmm.
Right now it's about like a 6, but when I'm chewing food, especially hard food, it gets to be about a 9.
Okay. Are you on any medications on a daily basis?
Yes, I'm on a 75 milligram bupropion
Okay.
and 100 milligram trazodone at night.
All right. Have you experienced any kind of soreness inside the mouth? Any open sores?
No open sores. Nothing
Okay.
like that. No.
Any tooth pain, toothache?
I've had that in the past, but it's all been fixed with dental work, so there's nothing currently that's aching.
Okay. And sometimes are you noticing any like abnormal taste or smell that comes out of your mouth?
Sometimes.
Even like a rotten kind of smell?
Yeah. Sometimes I smell something foul, and
Okay.
yeah, there's no reason for it. I feel like it's coming from a tooth or my mouth or something.
It might be like a stone that's impacted in your tonsils. So we're going to go ahead and check those and see if that's the case. All right. Perfect. And your last x-ray was also 4 months ago. There is no reason to do one today, but you did have more than 6 months in between cleaning, so we're going to do one. All right. I'm just going to have you lay down and I'm going to start the exam.
Okay.
Okay, I'm going to apply fresh gloves. Okay, I'm going to give you these glasses to put on.
Okay, thank you.
Okay. I'm going to start by palpating your face first. Looking at a TMJ. And I'm going to try to locate that cyst. You said it's on the right side, correct?
Yeah.
And if I'm noticing anything else extra, I'm going to go ahead and, okay. Definitely, I feel that. It's very, very tiny. And it hasn't grown, right? Since you noticed it. That's good. So TMJ stands for temporomandibular joint dysfunction. And the best way to diagnose this disorder is by performing an MRI of the joint. We can definitely do that after this exam. And once we diagnose it and we classify it, make sure that we know exactly what stage it is, and we can implement a program that will help to build the disc back up. And that usually helps with decreasing the pain. I'm going to place my fingers here. Let me know if you feel any pain. Okay. Okay, so go ahead and slowly open your mouth all the way. All right, and close. Definitely, I heard that click. Come back to center. All right, one more time. Open your mouth and close. Go ahead and open and close. So what I'm gonna do first, I want to make sure that the teeth do look good and they are intact. Okay, go ahead and open your mouth. So you're gonna feel kind of like a tapping sensation. Looking at the glands as well. I'm gonna start with the one in the back, the right side. If you experience any kind of pain, feel free to let me know. You can raise your hand up and we can stop. There's definitely a buildup of tartar. And how often do you brush your teeth?
Twice a day.
Okay. That's very good. Yeah, we definitely want to do that at least twice a day. And do you use fluoride?
I think so. I use Crest. optic white.
Okay. That's perfect. Alright, and do you also floss?
No.
Yeah, I can definitely tell. It would be really good if you go with the floss in between your teeth. You know, the food doesn't really get stuck in between there and definitely causes less tartar to be built. But I'm not seeing any cavities, which it's a good sign so far. Okay. So here it looks really good. Let's go ahead and check the upper teeth. Oh my gosh, it's been a very long time since you've been at the clinic. Last time you were here, you just got a puppy.
Mm-hmm.
Okay, there is one tiny spot here that only after cleaning we're going to be able to see if it comes out. It might be just a stain. So how's the puppy?
Good. You're so cute.
That's awesome.
Mm-hmm.
Yeah, she was really lovely when you brought her here in the clinic.
Mm-hmm.
Okay. Alright, I'm gonna go ahead and sanitize these. And clean your teeth first. Okay, perfect. Perfect. Looks like the tartar is coming out. Okay, go ahead and open. Go ahead and spit. Okay. And the upper side. Okay. So what I'm going to do now is I'll check the protrusion of your molars. So we're looking for misalignment of the jaw. And I'm going to use this blue paper to see exactly how your teeth are lying. So go ahead and open. Gently squeeze. Rub it front and then back. Slide it front and back. Good. And now open. And go ahead and open. Alright. That looks good. Alright, and now we're going to do the same thing on this side. Go ahead and close, slide it back and front. Good. And open. Okay, now we're going to do the same thing, but just slide it left to right. Left, go right. Okay, go ahead and open. Open. All right, and we'll do the same thing on the right side. So close, left and right. Okay, good, open. Right. Open. All right. I have this cream. It's called Mayo Magic. It has anti-inflammatory and muscle relaxant. So we're just going to go ahead and kind of like rub inside the cheek. We're going to go on the left side first. So go ahead and open. It's going to feel a little bit mentally, okay? Any pain here?
No.
What about here?
No.
What about here?
A tiny bit. Yeah.
Okay. So I'm just going to go ahead and rub that in for about 10 seconds. And we'll do that same process on the right side as well. Any pain? Okay. All right, so that looks good. Now we're gonna try to leave that in. I'm going to remove this. And then you mentioned that you would like to do a whitening process.
Yes.
All right, so what we're gonna do first, we're going to set you up with a guard. So first I want to make sure that this fits your mouth. Go ahead and try to open. It's a little bit too big, definitely. So let's go ahead and try something a tiny bit smaller. All right, how's that?
Good.
A little bit better. Okay, so I think this is the size that we're looking for. And our office uses My Smile. It works in about 10 minutes. It's non-sensitive and it whitens up to 10 shades. So let's go ahead and see exactly what we can do.
Perfect. Right. So I'm going to have you open your mouth. I'm going to try to insert this. Perfect. Close. I'm just going to try to fit your lips around it to make sure that you're comfortable. How is that? Is that good? Okay. Perfect. So we're just going to go ahead and turn it on. We're going to leave it for about 10 minutes. In the meanwhile, I'm just going to go ahead and check your lymph nodes. So we're talking preauricular lymph nodes and postauricular. The cyst that you have is definitely not a lymph node, because otherwise it would have shown on the CT scan. And submental. Okay, so what I'm going to do is I'll go get some cream that is on the same base, anti-inflammatory and muscle relaxant, and we're going to go ahead and rub it on the outside of your TMJ. So it's going to feel a little bit wet. It's on the right side, right? That it hurts the most. Although it is definitely recommended to be applied on both sides. I'm going to write a prescription for this, and you can use it up to 4 times a day. Okay, I'm going to apply some cold pressure as well. Okay, I'm going to apply some gentle pressure on each side. So let's go ahead and remove this. It's been almost 10 minutes. And we're going to go ahead and rinse. Okay, so what I'm going to do is I'll spray some water. Go ahead and open. Okay, one more time. Perfect. All right, so let's go ahead and do one final check here. I'm going to have you open your mouth. I'm just going to go ahead and remove these. Okay, looks good. And that was definitely just a stain. I'm not seeing anything concerning on the upper side. Good. You're not experiencing any sensitivity after the whitening kit? Perfect. Okay, so let's go ahead and remove that. Okay, thank you, Katie, for coming in. Don't forget to pick up your prescription from the pharmacy, and I'll see you back in 6 months. Let's go ahead and make that appointment now.
Okay.
All right?
All right, thank you.
You're welcome.
Hi, Ginger. I'm going to first put gloves on and then take a look at your spine and your back. I read in your file that you're having some more pain. So let's see what we can do about it and exactly what we're finding. Going to go ahead and put your hair up so that we can expose the spine. I'm going to start by palpating the cervical spine. Seeing some redness. That could be some lack of oxygenation in the atlas and axis. Feeling for the nucleus. A bit of swelling here. And there's a lot of pain over here, right?
normal curvatures of the spine. Take some measurements. Looking for asymmetry. That would indicate imbalance. Checking spine mobility to see if there is any tension in between the muscles. I'm going to take a few more measurements, looking for more inflammatory markers. So we're measuring the parts where we noticed some redness. I'm going to start with an exfoliation part before we begin treatment.
I'm going to start with skin pulling before we apply any type of oil. This will help to increase circulation in the areas that we want to work on. It will definitely help. So skin pulling brings blood flow to the surface and it helps to release toxins. Usually the redness that we see means just a lack of oxygen in those cells. Going to apply a mineral magnesium oil starting with the base of the skull. This is going to feel maybe a little bit, maybe like a tingling sensation and the upper side. Magnesium is usually very easily absorbed by the skin and it helps to relax the muscles. We're going to activate the lymphatic system, allowing for the lymph to be drained
drained and removed from the circulatory system. This is a very gentle adjustment of the spine, providing very light pulsations. We're trying to activate the paraspinal muscles. This further helps to desensitize the nerve endings around the paraspinal muscles and also to increase circulation in those areas. And just a gentle scratching. Going to apply acupressure, starting with the cervical spine, gently applying pressure for a few seconds. That usually activates the main organs as well. It helps to detoxify the body and to lower inflammation. I'm going to apply a little bit more oil. I'm going to use suction cupping to increase circulation as well as part of the overall treatment. And this helps to lower the soreness and to decrease the pain signal. So it's definitely going to feel less sore in the next coming days. It's going to feel a little bit cold, but it helps to stimulate blood flow as well. So I'm going to apply multiple pressure points, focusing more on the trapezius muscle. It's also going to feel a little bit cold. Going to go ahead and do a gentle adjustment, working on the upper back muscles, just trying to put the joints back together. I'm going to have you take deep breaths in, okay? This will allow for better oxygenation. training. I'm going to go ahead and put gloves on and take a look at your back. Since you mentioned that you were having a lot of soreness around the spine, I'm going to definitely pay more attention to the muscles. Looking for any pulsations, any rapid movements, something that would indicate maybe a nerve disorder. Also, some discolorations I'm noticing could be caused by a lack of oxygen to the fibers. I'm going to tap around the spine. We're testing spine mobility. I'm noticing a little bit of inflammation around T3. So definitely we're going to focus on the thoracic area to increase circulation. Checking scapula mobility now on the right side. Going to take a few measurements here. clean the area first. Then we'll take a few samples. We're also looking for elevations. So anything that comes into surface with the probe, we're going to be able to send it to the lab.
And sometimes these might cause some numbness around the area, so I want to make sure that everything looks good. I'm going to touch you with two textures. One is going to feel dull.
Okay.
This is what dull is going to feel like. And the other one is going to be sharp. Something like this. So go ahead and tell me if it feels sharp or dull for you.
Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull.
Okay. Looks normal. Now, can you please tell me if you feel this on the left or right?
Left. Left. Right. Right. Both. Both. Left. Right. Left. Left. Right. 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 I love
Good. Going to go ahead and apply an anti-inflammatory infused oil. It helps with inflammation and pain. You might feel like a warm sensation right when we apply it. I'm going to apply it all over your back. And we're going to start with cupping therapy.
we're focusing on the paraspinal muscles. Trying to decrease inflammation and increasing circulation in these areas. It's going to help with the sore muscles and to decrease pain, stiffness. Okay, I'm going to go ahead and remove the cups. I definitely want to make sure that we are removing them properly. I'm going to go ahead and use cold therapy to massage the areas that we are targeting. going to feel a little bit cold. I'm going to apply acupressure therapy to activate the main organs. This will help to release hormones that help to regulate the body heat. It releases heat, and that usually helps with muscle movement. I'm gonna have you get dressed, and we can go ahead and schedule another session for the next 2 weeks.
Very good.
Hi, Anais.
Hi.
It's very nice to meet you. My name is Dr. Matt. Can you please verify your last name and your date of birth for me?
Yes, it's Villanueva. The date of birth is January 8th,
Okay.
1992.
Do you have any allergies?
No allergies.
Okay. Taking any medications on a daily basis?
Yes.
Okay. What kind of medications are you
I
taking?
take a Prozac
Okay.
and just like the daily vitamins.
Right. Is that one time a day? The
daily,
Prozac?
Yes.
And do you know how many milligrams?
20.
Any surgeries in the last 6 to 10 years?
No.
Anything in particular that you would like me to address today?
I've had just a little bit of like pain in my neck.
For how long has that been going on?
Maybe a month.
Any changes in your diet?
No.
How often do you exercise?
I try 3 days a week.
Okay, and what kind of exercise is that?
Cardio and weights, upper and lower body.
Do you smoke or drink alcohol?
No. I drink just socially, but very little.
All right, medical history, any hypertension, hyperlipidemia, any diabetes in the family?
Arthritis.
Okay.
And that's about it, I think.
Right. So I do see here just a slight change in weight, about 2 pounds. We're just not concerning at all. It's a normal fluctuation. Would you like to be considered for our vaccines, the flu vaccine?
Yes.
Alright, so let's go ahead and start the exam. First, I'm going to take your vital signs. Any flu-like symptoms in the last 2 to 3 days?
No.
Okay. Traveling outside the country the last 2 weeks?
No.
And now, scale of 0 to 10, how would you rate your neck pain right now?
Right now, maybe like a 5.
Okay, is it localized on the right side only?
Mostly.
Okay, I'm going to go ahead and start with the temperature. This will be sublingual, so we're going to insert it under the tongue. Did you have anything hot or very cold to drink right before coming in?
I had a coffee, but it was more mild. It wasn't really hot.
Okay, so I'm going to have you hold this under your tongue. And this will go on your index finger on your right hand. Go ahead and relax for me. Heart rate 71. Oxygenation 98% on room air. Respiratory rate is about 14. So let's go ahead and check your temperature. 97.3, that's normal. And take this off. Alright. This will go on your left upper arm. It's going to feel a little bit tight. Just going to prepare your neck. Okay, go ahead and relax and uncross your legs for me. Uncross. Oh, uncross. Nice. Okay, relax your arm. Okay, blood pressure is a little bit elevated, but still within normal limits, 130/60. Okay, now I'm going to have you change into a gown and we're going to start the physical exam. Okay.
Thank you.
Okay, Anais, I'm just going to go ahead and palpate your neck area. I'm going to have you relax. We're looking for any lymphadenopathy. Something that would alert the immune system to be activated. Going up the network of lymph nodes here through the back. Just checking the right side of your neck and left. Palpating forehead and sinuses. And under your eyes, checking for any pressure. Checking your nose for any deviation of the septum. So I'm going to go ahead and cover one nostril. I'll have you breathe in, breathe out through your nose. And again. Right side is a little bit obstructed. Palpating mastoid bone behind the ear to see if there is any infection. I'm not feeling anything swollen. It seems to be symmetric. Palpating scalp for any asymmetry, lumps, or bumps. We want to make sure that head is normocephalic. We're going to check hair distribution as well. I'm looking for any signs of hair loss, vesicle malformation,
I'm gonna have you lift your head a little bit so I can rearrange your hair. Perfect. A little bit of dandruff, something that could indicate a hormonal imbalance. Skin is normal in color. No signs of alopecia. Looking at the hairline as well. We're going to check nerve impulses. So we're looking for any abnormal neurological responses. I'm going to check your facial sensation. Go ahead and tell me if you feel this on the left or right.
Right. Right. Left. Right. Left.
Go ahead and tell me if you feel this on the left or right of your body.
Right. Right. Left.
I'm going to listen for any breathing now. I'm going to have you take a deep breath in and hold it. Hold it for 1, 2, 3. Breathe out. And we'll do that one more time. Breathe in and hold it for 1, 2, 3. Breathe out. Okay, so there's no swishing sounds. I'm going to listen to your heart now. Go ahead and breathe normal. Is it okay if I open the gown a little bit on the side?
Yes.
Okay, I can hear only S1 and S2. No S3, no S4. That's very good. I'm going to check for murmurs. Excellent. We're going to measure your head circumference. Go ahead and lift your head up for me. Alright, go ahead and relax. Perfect. Go ahead and lift your head up one more time. Great, thank you. Okay, go ahead and tell me if this feels sharp or dull.
Sharp.
And what about now?
Dull.
Okay, so go ahead and tell me if this feels sharp or dull. Continuing from now.
Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. 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 Sharp. Dull.
Okay, that was very good. I'm going to go ahead and do more tests on the scalp area. I do see here a little bit of redness, so let's go ahead and check that. Go ahead and tell me if this feels cold or warm.
Warm. Cold. Cold. Cold.
And how many taps do you feel? 1 or 2?
2. 1. 2.
And does this feel sharp all the way?
Yes.
Does this feel sharp or dull?
Dull.
What about now?
Sharp. Sharp. Sharp.
Does this feel 2 or 1?
2. 2.
It's still within normal limits, so I'm not concerned. Let's go ahead and do a vision check. I'm gonna have you open your eyes and look straight at the ceiling for me. Okay, pupils are on and reactive to light. Going to check inside your mouth now. Go ahead and give me a big up. Alright. Tongue is symmetric. Can you please give me a big smile? Good. And now frown. I'm gonna have you frown with your eyebrows too. Perfect. And can you puff your cheeks for me and keep them puffed, okay? Don't let me unpuff them like this. Keep them puffed. Good. And now I'm gonna try to turn your head towards your left. Don't let me do that. Good. And the same thing on the other side. Don't let me do that. Alright. Okay. Now go ahead and shrug your shoulders for me. Perfect. Okay. Go ahead and open your eyes. And the same thing, I'm going to have you look straight at the ceiling and I'll come very close to your eye. We're going to examine your optic disc now on each side. A little bit of redness on the left side. When was your last checkup?
2 years ago.
Okay. Okay, right side looks good. I'm going to have you turn your head towards the right. We're going to check your ears now. I'm going to have you relax. It's going to feel just a little bit cold, so we're looking for any drainage behind the tympanic membrane. I'm not seeing any redness there. Okay, go ahead and switch. Tympanic membrane is blue gray. Just a little bit of built earwax. Good. I'm going to go ahead and take a few measurements. So we're looking for any asymmetry. We're going to check the skin for any lesions. You have normal cell growth. Checking for any swelling now. It's going to feel kind of like a pinching sensation. We're looking at hydration status and if there's any nutrition deficiency. Perfect. Listening to the sounds in all four quadrants. Going to percuss now. It's going to feel kind of like a tapping sensation. And to check for any kidney pain, I'm going to slide my hand right under each side and gently press on top. Any flank pain there?
No.
And we'll do the same thing on this side. Good. Now I'm going to slowly palpate on each side. I'm looking for any swelling, tenderness, or crepitus. I'm going to check for diastasis recti. So I'm just going to put 2 fingers to see if they fit in between the abdominal muscles. Okay, very good. Okay, now I'm gonna have you flip over on your side and we'll check your spine and your back.
Okay.
I'm going to go ahead and check the spine. I'm going to look for any lesions. Go ahead and tell me if this feels sharp or dull.
Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp.
Okay.
Sharp.
Good. I'm going to check for any abnormal nerve impulses. Go ahead and tell me when you don't feel the vibration anymore.
No. 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 No.
I'm going to elevate cervical spine. So I'm looking for any malformation of C1, C2. And checking for any scoliosis. Normal hydration status. Measuring spine and upper back. That's perfect. So now we're going to go ahead and check your legs. So I'm going to have you flip over on your back. Okay, nice. I'm just going to go ahead and take a look at your legs and feet. So we're looking for any redness, swelling, edema, and asymmetry. Both legs look normal color. Just going to go ahead and press down to see if there is any edema. I'm going to check pedal pulses to make sure that they are strong and symmetric on both sides. Good. I'm going to check capillary refill within 2 seconds. That means there's good peripheral circulation. And I'm going to go ahead and slowly palpate. We're checking for temperature to make sure that they're both the same temperature. I'm going to do some strength tests. I'm going to try to open your legs. Don't let me do that, okay? Good. And now I'm going to try to close them. Don't let me do that. Good. Now I'm going to put my hands right under your pads. Go ahead and push as strong as you can. Good. Now I'm going to put my hands under your heels. It's both the same thing. Go ahead and push. Good. Perfect. Now I'm going to palpate, starting with your heel, to see if there's any swelling, any pain here. Okay. Perfect. Now I'm going to look in between your toes to see if there is any redness, flaky skin, eczema. A little bit on the left side. So what I suggest is to do some soaks with water and vinegar. So you can do like 1 cup of vinegar and half a liter or a liter of water. Make sure that it's diluted, and that usually helps to balance the pH of the skin and to get it back to normal. So for now, I'm not going to prescribe any medicated lotions. I'm going to check the malleolus. Go ahead and tell me when you don't feel this.
Yeah.
And now?
No.
Okay. So what I'm going to have you do, I'm going to have you kind of like open the toes up, and I'm going to try to close them. Don't let me do that. Good. And I'm going to put my fingers under your toes. I'm going to have you curl them. Come on. Okay, perfect. Everything looks very good and normal. I'm going to have you stand up. I'm going to go ahead and remove my gloves here. And now we're just going to listen to your lungs. I'm going to have you take a deep breath in and exhale. Good. And one more time, breathe in and exhale. Okay, let's go ahead and check your back as well. Breathe in and breathe out. Breathe in and exhale. Okay, so I could not hear any crackles or wheezing, which is very normal. So let's go ahead and do the Snellen chart. You don't wear any contacts right now, correct?
No.
So I'm going to have you grasp the Snellen chart with your right hand. Go ahead and extend your arm all the way. And the left, cover your left eye. And can you tell me what letter this is?
L.
So go ahead and read the whole row starting with the letter L.
L. T. F. P. H.
Okay, good. And what color do you see here?
Red.
In here?
Green.
Right. And what number do you see here?
3.
In here?
2.
And which circle is smaller, 2 or 3?
2.
Okay. Go ahead and switch eyes now. Perfect. And now can you tell me what letter you see here?
H.
Go ahead and read the whole row starting with the letter H.
H. P. F. T. L.
Okay, and what color do you see here?
Green.
And here?
Red.
What number do you see?
7.
And here?
5.
Which circle is larger, 8 or 7?
8.
Okay, perfect. That looks good. Now I'm going to show you a few cards. I'm going to have you tell me kind of like your interpretation of what you see, okay?
Okay. I. Hockey. Plant. Spaceship. Scarf. Lips. Peanut.
Okay. Definitely everybody has their own interpretation, so I think it's still within normal. We're going to go ahead and just show you some pictures now. And I'm going to ask you just to slightly describe what they're doing and if you think it's, where do you think it is? Like what kind of environment?
They're jumping, and it's like a park or a forest preserve.
Okay.
They're brushing their teeth, probably in the bathroom. Kids are running at a park. She's whispering a secret at a park. Friends are whispering secrets to each other. Little toddlers playing with her dad.
Okay. That was very good. So let's go ahead and write this down for you. And right from here, I'm going to send you to the blood. You're going to just take a few samples. So we're going to check your chemistry
and CBC. So we're going to do a white blood cell count, red blood cell differential, and also we're going to check your cholesterol and your A1C to make sure that you're not at risk for developing any diabetes. Do you have any questions for me?
No, not at the moment.
Okay, perfect. Thank you very much.
Thank
You for coming in, and I'll see you soon.
Okay, thanks.
Okay, Hannah, go ahead and turn your head towards your left. Perfect. And you said you have a lot of itching right behind your ears, correct?
Yes.
And here on the side. So let's take a look. First, I would be concerned if there is any parasite infestation. So that's what I definitely want to check for. There's a little bit of redness here. It looks like it's more from scratching. But I'm not seeing any lice infestation. Here looks evenly distributed. A little bit of eczema. A small hemangioma here could definitely be caused by scratching. Looks round. Doesn't seem to be any crusted layers of skin around it. I'm going to take a sample of that
and we're going to run it with the school lab. First, I'm going to prep the site. I'm applying an alkaline solution. I'm going to use a spatula to collect the first sample. And now we're going to collect the swab. Okay, that looks good. And we're gonna go ahead and remove it. So we're applying an anti-inflammatory oil that will help to dissolve it. And this will help to absorb whatever is remaining. It uses a very gentle pressure. Okay, let's go ahead and check the other side. Go ahead and tell me if you feel this 1 or 2. Okay. Okay, does this feel sharp or dull? Does this feel dull? Does this feel dull? What about now? What about now? And now. And now. Right, a little bit more towards the left. There you go. Do you feel 1 or 2 puffs of air? There's a little bit of sensorial problem on the left side. So let's go ahead and I'm gonna have you turn and I'm going to examine your back. We're going to focus on this part first. And I'm starting with the bottom part. We're going to run a sensory test here. Go ahead and tell me how many puffs of air you feel, 1 or 2.
1, 2, 1, 1, 2.
I'm going to focus on the hairline most right now. Does this feel sharp or dull?
Dull, dull, dull.
Go ahead and tell me if you feel this sharp all the way.
Yes.
And now?
Yes.
Does this feel sharp or dull?
Dull.
And now?
Dull.
Go ahead and tell me if this feels cold or warm.
Cold. Cold. Warm. Warm. Cold.
And how many times do you feel this stop?
2.
Go ahead and tell me how many times do you feel this?
2. 2. 1. 1. 1.
Does this feel sharp?
Sharp.
Does it feel sharp all the way?
Yes.
What about now?
Yes.
Does this feel sharp or dull?
Dull.
You know?
Dull.
A little bit of redness, and it looks like it's coming towards the right side of the scalp more. We can definitely run some checks on that side as well.
Go ahead and tell me if you feel this sharp or dull.
Sharp.
Does this feel sharp all the way?
Yes.
What about now?
Yes.
And now?
Dull.
Go ahead and tell me. Go ahead and tell me if this feels cold or warm.
Cold.
Does this changes in the temperature?
Yes, cold at the beginning.
What about now?
Cold all the way.
Cold all the way. That's good. Does this feel cold or warm?
Cold.
And now?
Cold.
And now?
Warm. Warm. Warm.
Looks like we're just going to do a treatment. The treatment is going to be anti-inflammatory. It's going to help a lot with the sensorial loss that you are experiencing. First, I'm going to focus on the hairline and do a neck treatment. Is it okay if I take the necklace off?
Yes.
Going to apply an anti-inflammatory oil. It's going to feel a little bit cold in the beginning. And we're going to apply cupping therapy. Any pain as I'm doing that?
No, it feels good.
You're going to see a little bit of redness, but what this does is to increase circulation and help remove the toxins that are accumulated in this area. We're also working on the soft tissue in the neck. This helps to soften the muscles and reduce any neck strain. This is the second oil treatment. Doing a little bit of blood flow stimulation and soft tissue work. This helps to increase cervical mobility. going to use point pressure therapy to reduce swelling. We're really working on the occipital lobes here. It's very tight, so this is going to help to loosen up some of those ligaments. I see a little bit of redness. That just means that the toxins were able to be released from the cells. It's going to go away in a few days. Go ahead and tell me if you feel any kind of sharp pain traveling down the spine.
Just a little bit.
It does. Okay.
Yeah.
What about now?
Not right there. A little bit further up.
And does this feel sharp or dull?
Sharp.
What about now?
Dull.
And now?
Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Everything looks good. Go ahead ahead and take a look at the upper side of the scalp. I'm going to do a scalp stimulation and massage. This helps with hormone balance. I'm going to do a little bit of hair pulling therapy. This also helps to release some of that tension and increase circulation. Hi, Ginger.
Hi, nice to meet you.
Nice to meet you too. My name is Dr. Matt. I'm going to do your exam today.
Okay.
Can you please verify your last name and your date of birth?
Last name is Smith, Smith, and date of birth is 10/31/1991.
Okay. And what brings you in today? What's going on?
I've been having like some muffled sounds in my ears, so it's been a little hard to hear a little bit.
Is it in both ears?
A little bit, yeah.
Are you experiencing any pain?
Just slight pain a little bit.
How would you rate your pain on a scale of 0 to 10?
I would say maybe a 3 or a 4.
Are you taking any medicine?
No, not right now.
Do you have a history of infections? Frequent ear infection?
No, no history of it.
Have you noticed any other types of sounds, like any ringing in your ears?
Just a little bit hard to hear, I would say. So,
Okay.
yeah.
And when did this start?
About a week ago, I would say.
Okay. Any injuries in the last years?
No, no injuries.
And have you noticed anything abnormal with your vision?
I would say sometimes it's just a little blurry in like the sun, kind of.
Okay. And when did this start?
Maybe just like a month or 2 ago, I would say.
Okay. Any changes in your smell or taste?
Not that I've noticed.
Okay. Are you feeling any kind of sensitivity on your arms or on your chest and belly?
Maybe like a little bit on my arms and chest, I would say.
Does it go towards the back?
A little bit, yeah.
Okay. I'm going to just put gloves on. And I'll start with vital signs.
Okay.
Okay, so we'll take your blood pressure. I'm going to have you relax. This is going to feel a little bit cold.
Okay.
Blood pressure is good. 110/70.
Okay.
So that's normal. Right, first I'm going to check your olfactory nerve, and that's your sense of smell.
Okay.
But before I do that, I just want to make sure that there is no obstruction. So go ahead and look up for me, please. Just going to look inside a nasal canal here. I'm not seeing any inflamed adenoids, so that's good. So I have here, it's called Centaur, and there are a few smells that they're very easy to detect. I'm going to go ahead and cover one nostril. Can you please breathe in, breathe out? Okay, no obstruction there. Okay. Go ahead and try to associate this smell with something.
So like pepper.
Okay, yeah, that's good. All right, so there's no right or wrong answer, just whatever your brain associates the smell with.
Smells like roses.
Okay.
Smells like lemony Febreze.
Okay. Now I'm going to take a look inside your ear. I'm going to have you look towards your right side. I'm going to have you relax. Okay. There's a little bit of redness, but it's kind of hard to visualize. There's a lot of earwax on the left side.
Okay.
Exactly the same thing on this side. What we can do today is to do an ear cleaning. I'm gonna have you lay down and we'll take a look and see what kind of treatment we can do.
Okay, yeah, that sounds good.
I'm going to check your hearing first. Can you please tell me which position here is louder? Position 1, which is this one, or position 2?
Position 1.
Okay. Same thing on the other side. Position 1 and 2.
Position 1.
Okay. Go ahead and tell me when you don't hear this sound anymore.
I don't hear it anymore.
And what about now?
I don't hear it anymore.
Okay. I'm going to touch you with two textures. And one is going to feel dull, the other one is going to be sharp. This is what dull is going to feel like. And this is what the sharp is going to feel like. Go ahead and tell me if you feel sharp or dull.
Dull. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp.
I'm going to go ahead and palpate both ears in the same time. I'm looking for any tenderness or anything swollen on the outside. Any pain here? So I'm palpating on the masted bone.
No, no pain.
Okay, that's good. I'm not seeing any redness either, so that's a good sign.
we can definitely take out of the way any signs of mastocytitis. All right. So first I'm applying a necktie bacterial spray. This will go on the outside, on the tragus. It's gonna feel a little bit cold. Okay, this is going to feel a little bit wet. Go ahead and turn your head a little bit towards the right. I'm going to apply an unscented gel. It is antibacterial and it's going to help to really catch some of that earwax. just a gentle cleanup here to remove some of the earwax that's stuck on the ear canal. Going to apply a little bit of magnesium oil. It helps to decrease inflammation and to relax the muscles so that we can go ahead and do a little bit of cupping. It helps to drain some of that fluid that was stuck under and behind the ear on the medial side. And apply acupressure on the mastoid bone, going down and just trying to activate the lymphatic drainage. Gently applying pressure on the trigger points. This is gonna feel a little bit cold, just applying some pressure here. This helps to stimulate blood flow. I'm going to go ahead and apply ear seeds. Just going to try to find those points that correspond to the main organs so that we can activate them. The first organ that we're going to try to stimulate is the spleen. And the spleen is found kind of like on the lower side of the earlobe. This acupressure ear seed applies continuous pressure on that trigger point. Also, we're going to stimulate blood flow to the liver. It's going to help to detoxify the body. And lastly, I would like to activate the adrenal glands. It's going to help to lower stress hormones. And it's going to help the body balance. Just going to gently apply continuous pressure here until it sticks.